Hi, I'm Dr. Iman, internal medicine consultant here at Valiant Clinic. It's Folic Acid Awareness Week or Folate Deficiency Awareness Week, and I wanted to shed some light on this important vitamin and its importance in our body and the conditions or diseases that can arise if there's a deficiency in folic acid. Folic acid is one of the essential water-soluble vitamins in our bodies. It's among the B vitamins, also known as vitamin B9, and it's found in green leafy vegetables, in fruits, certain fortified foods such as cereals, and it's also found in certain meats such as liver. Folate plays a very important role in the production of red blood cells in the body. And as we all know, red blood cells have the important function of carrying oxygen around our body. So a deficiency in folic acid can lead to a certain type of anemia known as megaloblastic anemia, and this affects our body's ability to be able to transport oxygen. Folate deficiency, what are the causes? One of the most important causes is an unhealthy diet or malnutrition. So people who don't consume enough fruits and vegetables in particular can develop this deficiency. It's also present in people who have certain conditions. Either they're born with it or they acquire it later in life that makes it hard for them to absorb folic acid. One of the most important conditions that can lead to this is celiac disease or gluten intolerance. Another potential cause can be certain medications that affect the absorption of folic acid, such as medications that we use to treat such seizure disorders, or medications that we use to treat, for instance, certain autoimmune conditions or multiple sclerosis. And this can also lead to a folate deficiency. Another important cause is excessive alcohol intake. This can also reduce the absorption of folic acid, and in general, people who consume really high amounts of alcohol tend to have an unhealthy diet in general. Another potential cause is when there's increased need in the body. For instance, for women, when they are pregnant or breastfeeding, the body's demand for folic acid increases because there's a baby as well that has increased requirements and needs. And this can increase their risk of developing folic acid deficiency. The symptoms of low folate can be many. The most common are related to the presence of anemia, or what we call megaloblastic anemia. So you can see pallor, or basically pale skin, fatigue, shortness of breath, particularly when exercising or in exertion. Another common symptom is hair loss or inflammation of the tongue, a condition known as glossitis. So the tongue can become swollen and red and inflamed. And also gastrointestinal symptoms in the form of either nausea, diarrhea, some pain in the abdomen, and also a reduced appetite and weight loss can occur. Another important symptom is increased pigmentation of the skin, particularly on the back of the hands and feet and within the creases. This can also be a clue as to a folate deficiency. I wanted to point out the importance of taking folic acid supplementation to prevent neural tube defects. So in particular, if there's a deficiency in the mother when she's pregnant, the fetus relies on folic acid in the production of the brain and the spinal cords. So deficiency in folic acid increases the risk of developing what we call neural tube defects. And this can be in its severe form, can present as anencephaly, which is an absence of a certain part of the brain and the skull. And of course, this can lead to cognitive decline. And it can also affect the formation of the spinal cord, which can lead to paralysis or weakness of the legs in the fetus once they are born. Additionally, the cognitive function or the intelligence of the child can also be impaired if they have been exposed to low folate during the course of the pregnancy. So it's a very important vitamin and mineral, particularly for a pregnant mother during the course of the baby's life inside the mother's uterus. In addition, it plays an important role, as we said, in the production of red blood cells, in our overall mood and cognitive function, and in our overall well-being.